In India, there is 2 million people who are suffering from arthritis. In my 23 years of practice, I have seen many of the patients from 40 years to 80 years who come with the problems. The main problems they will be either the knee joint or the hip joint or the shoulder joint. Invariably, as the age goes, they will develop an arthritis. This is an arthritis where it is because of an aging process, the cartilage inside the joint gets wearened out and start getting pain. Apart from that, we have other diseases like rheumatoid arthritis, and when the patients or the people, when they fall, they get an injury to the cartilage, and that invariably over a period of time develops an arthritis. So what is the solution for this problem? They take medicines over a period of time which will not come down, and also they go for a physiotherapy in form of an exercises, cold therapy and heat therapy. These are all the ways to reduce the pain. But a stage will come where whatever the medicines they take, the pain will not subside. And at this stage where the people needs an intervention. The intervention will be in the form of surgery. Conventionally, over a period of time, we used to do a surgery called knee replacement surgery in the knee, and hip replacement surgery in the hip, and shoulder surgery, which is not so common, but over people, if they get an arthritis, we used to do a shoulder joint replacement. The conventional replacement is the one which we open the joint and replace with the artificial implant. The problem with the conventional is there will be a bleeding and the pain factors which will be a little long to come down, and also the patient has to go a lot of time for rehabilitation. This is been drastically reduced by bringing a technology what we call a robotic assisted total knee replacement. I would say called robotic assisted surgery, because this type of robotic assisted which can be used in the knee joint, in the hip joint and shoulder joint at present. So what does it makes the difference from conventional to the robotic assisted? When the patient comes with the pain, pre-operatively we will take the patient to the CT scan, and this CT scan is different from the regular CT scan what we do for the patient. The CT scan is made such a way that it has to assist the robo. We do the CT scan 1 day or 2 days priorly. So when the CT scan we get it, we'll feed it, we'll send it to the US. The US, there they do a mapping of the patients with the CT scan which is present. So then they'll come into a decision what could be the implant size which we have to use to the patient. So that means that you are not putting all regular for every patient one size of the knee. It is individualized according to the patient's knee anatomy. Here, what is robotic assisted? The robotic assisted is the one which uses the GPS technology. That means that the patient is on the table. We have got a special iris, what we call a radiations, that is a signals which sends from the knee to the camera, and from the camera it goes to the monitor. It shows how the knee is positioned and what we are cutting, how much we are cutting, what should not be cut. So we get the 3D technology in front of us and then the screen. This will not be in the regular conventional technology. So when we have in front of us, so we decide how much we should cut the bone, what are the damaged cartilage which is there, which we need to cut the bone. Accordingly, we will go and size it. And when we cut it, there we go the assisted technology. Here, we do not release the soft tissues extensively because we release whatever is necessary. This is where our 3D technology helps in. And Robo also helps in not to go away from the field. This is where it helps in reducing the complications. We don't have any problem or no complications in cutting the blood vessels which is very close to the bone. So this way, it helps in coming out with a very helpful to the patient, and the blood loss will be very less, so that the patients also will be benefited the post-operatively after the surgery when he comes down and when he walks after the surgery. We have seen with our many patients who have done with the surgery post-operatively how they have done very well. Conventionally, if you take, the hospital stay will be around 3 to 5 days. But whereas in the robotic surgery, we have seen the patient gets benefited in 1 to 2 days. That is 24 hours to 48 hours, the pain factor will come down. Also, the patient's rehabilitations post-surgery drastically improves. When the pain comes down, the physiotherapy, the exercises, what they have to do also will be very much, they get a boost up to do a therapy, thereby getting the results as early as possible. In India, there are 2 million people who are suffering from arthritis. The quality of the life which they end up because of the suffering is incredible. They try to take medicines, painkiller, and ultimately we have seen many patients coming with kidney failure. So all these are all because of the patients getting afraid of the surgery. 20,000 of the knee replacement is happening in India. That means that still there is a lot of people who are suffering with an arthritis not getting to the point where they can relieve their pain. Robotic assisted surgery helps the people in getting relief of the pain and to improve their quality of life. There are 1,500 installations of Mako Robo. This is a first FDA approved in the world. The technology comes from the Stryker company, USA one, and there are out of 1,500 installations, the first installation which has been done in AASRA hospitals, Bengaluru. I am proud to say that with using this technology, we have given benefiting to the many patients, and the patients have taken the benefit very extensively and very happily. They have to come so that use the technology and get relief of the pain so that their lifestyle will improve. There is no longer for the people to suffer with the pain. We are here for you. We are here in AASRA Hospital.